I'm Dr. Jerry Hesch. I'm a physical therapist and an orthopedic manual physical therapist, which means that I specialize in treating joints. And this presentation is on treating the atlas as it moves on the axis. And many treatment paradigms adjust the atlas with a force on the outside of the neck, contacting what's called the transverse process. And that will correct side-to-side movement, and it may affect rotational movement. But what it does not do is it does not correct forward or backward bending movement of the top vertebrae number 1 in your neck, called the atlas, as it moves on the second vertebrae, called the axis. And I often see people who have had a large number of adjustments to the atlas, sometimes with a little air hammer, or sometimes with a manual contact, or sometimes with a little plunger device that puts pressure on the transverse process. And they will have normal rotational mobility and normal side-to-side mobility from that adjustment, but many times they are still stuck in hyperextension, and they require a separate technique, which I have developed using traction on a specific portion of the head to isolate force on these joints where they connect with the base of the skull with the occiput. And so I use a very gentle manual force to induce traction and to restore forward bending mobility in the atlantoaxial joint. And that can result in significant reduction in upper cervical pain, also called cervicogenic headache. And so after one has had treatment, a fair number of treatments with a atlas technique, it's always important to then see someone who can evaluate traction mobility and flexion mobility of the atlantoaxial joint. And that is what we do at Hesch Institute in Aurora, Colorado.